Good morning for those of you who are just joining us. I'm just going to wait maybe one more minute to see if there's anyone else that joins us. And then we'll get started with the workshop. If you have any questions, you can go ahead and put them in the chat. There will be a chance at the end for Q&A. But if you do have questions during the presentation, feel free to put those in the chat and then we'll get to them after the presentation is over. Some of the questions might be answered during the presentation, so I just want to make sure that we have a time for fielding questions at the very end. But if you do have questions, feel free to put them in the chat and we'll get to them as soon as possible. Okay, so we'll go ahead and get started. Hi, everyone. Welcome. My name is Danielle Huggett. I am the part-time chair for the Faculty Association. We have Christy Colston with us that is from HR, and she'll be hosting most of this, and then we will ask her questions about all of the nuances that maybe we won't cover during the workshop itself. So this is how to apply for part-time health insurance. And we will go ahead and get started. So I'm going to turn it over to Christy. We are recording this also. So and we set it up with our IT person this time. So we'll be able to send this out to everybody that's registered. So if you do have any questions or anything like that that we maybe can't answer during this time, we will make sure that we field those questions to anybody who can answer them, and then I'll get back to everyone also. But if you'd like a recording of this workshop, I will send it out to everyone once we're done as well. All right, I will hand it over to Christy.
Hi, everyone. Thanks for coming. Hopefully we'll get most of your questions answered in regards to how to apply for this part-time faculty health insurance reimbursement program. So that's the first thing I always like to point out. This is not health insurance. We do not offer health insurance to part-time faculty. This is a health insurance reimbursement program that reimburses you for the cost that you have to go and buy healthcare. So we understand that you have to go buy healthcare elsewhere, whether it be through another employer or through Covered California or through an insurance company directly or through a spouse's employer. However you purchase health insurance, we want to be able to reimburse you for those costs. However, there's a couple caveats to that, is that we only cover you. So if you are on a family plan or if you have a plan with a spouse, we only need to know the amount that is you. And some people find that a little hard to determine. So I have some examples in what I'm going to show today so that it can kind of explain how to do that. So again, this only covers you as the employee of the South Orange County Community College District. We also do not cover dental insurance or vision insurance. This is only for health insurance. Okay. So things have changed this semester and kind of going forward in your new contract. So I do want to show kind of what the requirements are and what the eligibility is. So I'm going to share my screen here. So there is an eligibility. Make this a little bit bigger for you guys. And it has changed this year. So it has opened up and allowed a lot more people to be enrolled. So you have to have completed 4 semesters in the district. That's 2 academic years, and we're only looking at falls and springs. So summer does not count. So, and it means completed, which means you have worked in the district at least 2 academic years, 4 semesters. Okay. And then the second one is that you have to be assigned in at least 4 semesters in the last 6 semesters. So, or in the last 3 academic years, were you assigned at least 4 semesters? Okay. I know that gets a little confusing because it sounds like it's the same thing as number 1 and number 2, but they are very different. Okay. So the first one is you have to work with the district at least 2 years before we even start looking at anything else. If you haven't worked with the district at least 2 years, you're simply not eligible. Okay. But once you've worked with the district at least 2 years, then we can go on to number 2 and have you worked at least 4 semesters in the last 6. What that is allowing is it does allow you to have a semester or 2 off or classes not being assigned, and still be eligible in future semesters. So that's what that last 4 semesters in the last 6 means. Again, that's only looking at falls and springs. It does not look at summer. Okay. And then the third qualification is in the last 12 months, did you work at least 9 LHE in total? Not 9 LHE per semester, but 9 LHE in total. So that is looking at summer. So in this semester, I'm looking at last spring, last summer, and last fall. So all spring, summer, fall of 2024. What is the total number of LHE that you worked? That number needs to hit at least 9. If you didn't work a semester, that's fine, as long as the other 2 semesters hit 9. So if you didn't work summer, but you worked 6 LHE in spring and you worked 6 LHE in fall, you've met that number of at least 9. Okay. And then finally, this semester that you are receiving this benefit, you have to be assigned at least 3 semesters. I know it says teaching, but it means assigned. So counseling does count for that, at least 3 semesters. Or I'm sorry, 3 LHE this semester. Okay. Now you have to hit all 4 of those every semester. So if there's a semester where you're not teaching 3 LHE, but you hit the other 3, you're not going to be eligible. Okay. Any questions on eligibility? Great. So once you hit those 4 things, those 4 eligibility requirements, every semester we send you an email. So you don't have to keep track of your eligibility. You don't need to, let us know. We send you an email and we say, hey, you're eligible. Congratulations, you are now eligible to apply. If you are eligible this semester, you should have received an email on January 10th, and you should have received a reminder yesterday. If you didn't receive any one of those 2 emails, then you are most likely not eligible this semester for one of those 4 reasons. Okay? So what this does is this allows us to pay you an allowance for your buying health insurance outside of our district. And again, this is for coverage for you only. Now, again, this did change this semester, and going forward, with the new contract, these amounts did change. So it's a little bit different than it has been in prior semesters. So if your cost for your insurance only is somewhere around $100, from $1 to $100 per month, we would pay you $100. Okay. If it's more than $100 to $250, we pay $250. If it's in that $250 to $500 range, we pay $500. And if you pay over $500 a month just for your employee only cost is $750. If you are a Medicare recipient, there is a flat rate for Medicare, and that is $350. Okay. What that means is when you turn in your documentation and you show us how much you're paying for your insurance only, we place you into one of these tiers based upon what we see. Okay. There is a program cap to this program, which means there is just one pool of money that we have every semester, and that is $768,000. So when we have the total of everybody coming in and their monthly amounts for the semester, if we hit that cap of $768, we then have to reduce everyone's amounts. If you've had this program before, you knew that we had much less money. We had about half the amount of money in previous semesters, and we would hit that cap quite frequently, and everyone's amounts were reduced. So the Faculty Association and the district have discussed, and they've doubled the amount of money that we have available to this program. So it's good for everyone, and hopefully we won't see amounts being reduced. Okay, but it is possible. So the documentation that is required, there are deadlines, and the deadlines are dictated by the contract, so they are hard and fast deadlines, and there are no exceptions. And every year I get at least one person that says, please make an exception, and I say, I'm sorry, I cannot make an exception. So your deadlines for this spring semester is February 10th, I believe it's a Monday this year, at 5 p.m. Pacific time, which means We need to have your complete packet in our email box by 5 p.m. on February 10th. Okay. I urge everyone to not wait until February 10th to submit their documents. The reason I urge you not to and to get them in as soon as possible is if we have questions, we have time to get those questions answered. And if you submit it to me on February 10th at 4:58, you're out of time, and you're out of time to get any questions answered, and you'll most likely be declined if you're missing something. So I want to make sure everyone that's eligible for this program gets to participate. And so I urge you to get them in as soon as you can. Okay. So what must your packet include? It has to include 3 things are listed here, but if we can get that all completed in 1 or 2 documents, that's fine. If I need 6 documents, that's fine. You just want to make sure that you're hitting all the points and you're ensuring that we can see all of the information for your coverage. So the first thing is a signed application or affidavit from the current semester. This document changes every semester, and you can only submit the current one from the semester. So if you have one from previous semesters and try to just resubmit it just to get it through to us quickly, we're going to say, no, we need the current one. So it is included in your email, and it looks a little bit like this. All it's asking for is your employee ID number, your name, and how much you're paying for your insurance, either per month or per year. One or both of those boxes can be filled out. And then we ask how you're covered, and then just need your signature and the date. Okay, so this document should be pretty quick, pretty easy to complete. The next one that we need is proof of current enrollment in your qualified plan. That can be done a couple different ways. Either a declaration that shows your plan is effective as of this date, a document from the insurance company that says your plan is effective this date, a copy of your insurance card that says your plan is effective as of this date, just something that shows you are currently enrolled in that plan. Okay. And then we need proof of costs. So again, examples of that could be the declaration page or the full invoice showing the cost. Okay. Could be a Medicare statement or Medicare card. Okay. And then pay stubs from a spouse's or another employer along with the list of their coverage costs. Okay. So I have put together a couple of examples to show you what those documents will look like. Okay. So there are other people's examples, so I have redacted information, so yours may not look exactly like this. But if you are on Covered California, you should have received a document that looks like this, probably at the beginning of the year, that says, here you go, here's who's on the plan, here's what plan you have, and here's your monthly premium. Okay. Now, if there's a list of many names here, I need another document that shows how much your cost is, because this is going to be the cost for a family plan. And what I'm running into a lot of the issues are people that are in Covered California with a family plan or plan with just their children or plan with them and their spouse. It is impossible to pull out what your cost is just for you. Covered California won't do it. The health insurance companies won't do it. So what we ask you to do is to go into Covered California again and request a quote of this exact same plan for just you. Okay, so if you have a family plan on Covered California and you are running into walls, not being able to find out how much your cost is, we just ask that you get a quote. We don't ask that you put in your personal information. We just get a quote and then attach that quote with this information. Okay. If you have another, or if you pay directly to your insurance company, you should get a bill from them. And it should come in your so a lot of people, it should just come in your email and you probably don't even notice it because you're on auto pay and you don't even know that this comes to you. So you should get a document from them we ask for the full invoice. I want to see the full invoice. I don't just want the first page. And the reason for that is because we need to see who is covered on that plan. So this is just I did redact a lot of the pages on this, but you should send us the full invoice that shows, this is the coverage period of when this is going to happen. And it also tells me who's enrolled in the plan. So this is just one person on the plan, and this is how much they pay. Again, if there's many people listed here, I would like to see an amount for each person. That's really easy. But if it's not, I need another document that shows how much your cost is. Okay. If you have Medicare, this is a perfect example of what I need from you. Just your Social Security benefit paperwork, and it says we deduct $185 for medical premiums. If you are paying into other medical or Medicare Advantage plans, other things like that, where you're paying Kaiser or you're paying Health Net for additional funds, that's fine. You can include that as well. However, there is a flat rate for Medicare, and if we see that you have Medicare, you're just at the 350 rate, even if with your Advantage plans and everything else, you're paying more. Right? And then the last one that I have, and this is this semester becoming the most tricky thing to get, is a spouse or another employer. So if you are covered by another employer, I need a document that looks like this, that tells me how much the rates are, right? Some of them are probably a lot longer. Some are, if they only have one plan, one a lot smaller. But I should always get a document that looks like this if you are being paid from another employer and their documentation isn't clear as to how much it costs, or if you have a spouse or you're covered under a spouse's plan. This is what shows me how much your cost is specifically for you. This document should be really easy to get from another employer, as they give these out to every new hire that is trying to get medical insurance, and they give you one of these every time you go in for open enrollment. So it's either a sheet by itself or it's in a brochure. They should be able to get it to you really, really easy, because they hand these out all day long in their either HR benefits program, and it should show what their plans are and how much it costs for each employee group. Okay. I also need that in addition to a paycheck stub that shows the amount being deducted. And then something that shows that you are enrolled in that plan. Okay. Any questions about documentation?
I have one.
Go ahead.
I am I am a adjunct professor and a PhD student at University of Arizona. So in my bursar's account, it'll say student in health insurance. It sort of looks like this, but it's a little bit different. Would that be adequate?
Yes. As long
O-
as you have something that shows you're covered under that plan. Yes.
Okay, so something from the bursar's account and then something from the United Health. Okay. All right, thank you.
Yeah. So if it's like a deduction from however that comes out, or if it's just that you're covered and how that deducts, just something that shows how you pay for it, and something that shows like this, and then something that shows that you're in the plan. So like a medical card or something else like that.
Okay, perfect. Thank you. And we show our actual payment to the bursar too, so you can see that we paid for it. So
Yeah, perfect.
thank you.
I have a question that came from an email from a part-time person, part-time counselor, and her and her husband both work at IVC. They have their information, or sorry, they have their health insurance through Covered California, and they cannot figure out how to separate them. Like you said, it's almost impossible. So they would both go and get a quote with their names on them, and then each one of them would submit for themselves, right?
Yeah, that one I would say probably one quote. Well, no,
Okay.
you would need to do two quotes because I'm
Okay.
assuming